Hi everyone. In this video, I'm going to give you a very short introduction in how to do an outpatient clinic as a trainee doctor. You can see in a previous video how to access your appointments, but now I will open a patient and show how I would generally approach an outpatient clinic appointment. We can see this test patient is coming to see us for asthma. First of all, if we work down the left-hand side, you can see their demographic details. In the live version, there is also a hyperlink that opens their NIECR. This is very important as any patient referred before Epic go live will not have their referral uploaded onto the Epic system. So you can see their current medications, their referral information, and any previous clinic letters prior to go live by clicking on this link. Moving along the left-hand side, the patient's height and weight for this appointment will be updated here. And you can see very helpfully the growth centiles beside it, which you can then copy across into your clinic note. You can also see any recent lab visits or microbiology results since the last review. That's the main things that we use in the left-hand tab. So we'll now move on to chart review. So if we click on this, this shows you all the information from previous encounters after go live, but some pre-go live will also be viewable here. Notes is obviously very important. You can see all the clinic appointments since go live and any inpatient admissions as well. Labs does show all labs that the child has had prior to go live and after go live as well, so you can review anything here. Imaging is also viewed here, so you can see in this column when any imaging was ordered and then when it's performed. If you double click on this, you can get the report and you can also view the image in this as well. It's not possible in the playground version, but there is an option to view the image yourself if you wish. If we go back into cardiology, any ECGs and 24-hour tapes will be viewable here. And again, you can view the ECG in this manner as well. Procedures shows certain other tests. EEGs requested will be one of the tests that you'll be able to see in this tab. Any medications prescribed after go live on the Encompass system will be available here. But remember, not all GP prescribed medications will be viewable here. In media, you can see any clinical photos, any other uploads such as genetics or certain referral tests or EEG reports. Letters will show all clinic communications. Referrals will show if the patient has been referred to other specialties, again after go live, but sometimes historical referrals will also be uploaded here. And then other orders is very helpful to know whether the child has had a review appointment organized, and you can see that's normally coded as appointment request clinic. So now that you've reviewed your chart review, the next step is to go to charting. The first thing to fill in is the visit information. You can see this has already been populated as follow-up, but if you want to give a bit more information, for example, while seeing this patient with asthma, so I could click wheeze, I could also search for asthma, or if you want to put your own, and then you can add that as free text. And then click next. The visit diagnosis you can do afterwards, but if you are aware that the child has other issues that you're not directly seeing them for, but does impact on it, for example, say we thought that autism was an important part, we could say add that to the problem list and then click accept. The reason it's important to fill in your problem list and your visit diagnosis is if you're following this child up long term, this will be stored for the next time, which makes your follow-up appointments much easier. If there's any allergies, you can fill this in. And then when you're taking the history from the patient or when you're reviewing NIECR, if you click on medication management and patient reported, you can then copy any medications across. So for example, if this child you noted was actually on a Clenil inhaler, you can search this, add it, and the patient confirms that they're taking it and then click accept. And then that will We can see they're already on it, but in this situation, you can add this in as their medication. Now that this is all done, you can then review the patient. So this is your right-hand toolbar. We'll talk about smart phrases in a different video, but if you have a smart phrase, you can fill this in. I would write a summary note that says clinic review, and then I'll just write brief notes on the consultation. So depending on whether you're going to dictate a separate letter or whether you're going to use your clinic note as the GP letter will depend on how much detail you need to put into your notes. Once that's done, if you click accept, and then it's important at the end of the visit to put a visit diagnosis. So I will again put asthma. Say you wanted to do some blood tests in clinic, you go to the bottom and say add order. And you can see they've been added at the bottom of the screen. We'll maybe refer this patient to refer them to pediatric respiratory. We fill in this. Again, we'll show how you do this in different videos. And once you've done that, you can sign orders. I'll just cancel these for now. We then, once we've got our clinic note all finished, we've done our investigations, we then go to conclusion. This part is very important to get right. So we're going to review this patient. So we would click then new decision to treat, treated this visit. If we want to discharge them, we can say treatment, continued discharge. These are not really relevant. And then we're going to review them in 6 months' time. So you go to follow up, order your review, and click accept. This then brings up an order at the end. And then you just check that it's 6 months, check that it's the correct clinic, check the booking office, and then click accept. And then that's your follow up organized. The next clever thing that we're able to do is to generate a GP clinic letter based on our clinic note if we wish. In this, we click clinic letter, and we can see this automatically generates a template. Everyone might use their own template, but this is just the generic one that's part of the template. So you can see that my clinic note has transferred across, and obviously this is not particularly detailed, but if I was doing it in real life, I put more information. Once you're happy with the clinic letter, you then add your recipients. So it's important to click GP practice rather than the specific GP because that will go as a paper copy. If you click GP practice, then it will transfer electronically. It's up to you whether you send it to the patient or to anyone else. So you might send it to the patient. And another tip, which is not available here, but a lot of them have a care team. And if they're known to specific individuals, if you can include them very easily and you know who they're also attending. If you want your secretary to clean it up before sending it, you can route a draft to staff and then put whichever secretary you have in there and put routing instructions, for example, clean up letter. If you're happy with the letter as it is, you don't need to do that. You can just send it directly yourself. So once you're happy with the recipients and the letter, you just click print and send now. And then that's it sent, and that will go directly to the GP, and any letters that need to be printed are then sent to whatever printer you're using, and you need to make sure those are then posted. We'll finish our unsigned order, we'll sign that order, and then once you're completely happy with that patient, everything's done, your clinic note's done, your letter's sent, all your referrals and subsequent parts are done, you then just click sign visit, and then that closes the whole chart. There's a few other things we need to do, so that won't close, but in real life that will close it, and then when we go back to the schedule view, you would see that it would have updated to patient complete.